Hi everyone, my name is Julie Wong, and I'm going to be presenting on data fallacy, the case for Asian Americans. To introduce myself, I'm a rising senior at Edgemont High School in New York. I have a strong interest in global and public health. I've been especially engaged in the field of food security, from researching apple pathology to promoting nutrition education at a nonprofit organization and raising awareness about food insecurity through public speaking. In the future, I'd like to continue to research and bring health equity to my community and beyond. I am also the co-president and treasurer of my high school class officers, and I'm the founder of the Global Ambassadors Club to promote youth intercultural connection. I'd like to start off with a story from the New York Times. Mahendra Agarwal, a 63-year-old Indian American, had a healthy lifestyle, exercising regularly, following a vegetarian diet, maintaining normal levels of blood pressure and cholesterol. So it came to everyone's surprise when Agarwal had a sudden heart attack. So what could have caused this? A risk factor for Agarwal was actually his Indian ancestry. In fact, South Asians are 4 times more likely to develop heart disease than the general population, and they contract the disease up to 10 years earlier. This is because South Asians store fat in a different way than other groups, so they are more prone to developing high blood pressure, high triglycerides, abnormal cholesterol, and type 2 diabetes at lower body weights. Now you may be wondering, why hasn't there been much research to solve this? The issue is that the link between South Asian ancestry and risk of cardiovascular diseases has been largely unknown, since it has been obscured by data aggregation. So what is data aggregation? It is when health researchers condense data about Asian Americans as one group, masking the many differences between Asian American subgroups, coming from 50 different countries and speaking more than 100 languages. Aggregated data does not represent the diversity of the Asian American population. In turn, this misleading data dictates policies and programs that do not properly support or account for Asian Americans and their needs. As a result, data aggregation leads to greater health inequity, leaving marginalized Asian American communities stranded from the help they need. The aim of my presentation is first to promote awareness for why data aggregation is problematic in health literature and the consequences as a result. Second is to investigate and propose solutions to eliminate data aggregation. And third is to cultivate a future to achieve health equity for all. So why is data aggregation a global health issue? The issue of data aggregation extends far past Asian Americans, to Canada and France, where data by race isn't recorded at all, or to the UK, where research by ethnicity is highly inconsistent. These all pose a significant challenge to health equity and global health. Now that we've learned what data aggregation is, I'd like to further explain Mahendra Agarwal's case. This graph shows that if we look at Asian Americans as a whole, the mortality rate is higher for cancer than heart disease. But for Indian Americans, it is actually much higher for heart disease than cancer. In fact, Indian Americans' mortality rate for heart disease is 50% higher than it is for Asian Americans as a whole. Despite this reality, policymakers would only take data for Asian Americans overall into account and wrongfully prioritize addressing cancer. So, from an American standard, Agarwal was categorized as having normal levels of blood pressure and cholesterol, delaying his diagnosis. If doctors had taken Agarwal's ethnicity into account, they may have been able to test for heart disease earlier. Here's another example of data aggregation. This survey aimed to quantify type 2 diabetes prevalence among Asian American adults. But they did not properly represent Asian Americans in their sample. They used an abnormally small sample of 300 Asian Americans compared to 40,000 total participants. They also condensed their data into Asian regions, obscuring key differences between specific Asian ethnicities. For example, this graph from another survey, actually shows that the type 2 diabetes prevalence in Filipino Americans is 31%, which is significantly greater than their region being 18.7%. Keep in mind that misleading surveys like this dictate public health policy. The amount of funding, research, and attention directed to Filipino Americans' high type 2 diabetes prevalence would be grossly underestimated, preventing many of them from accessing early detection and treatment. This isn't just for type 2 diabetes. For example, while Asian Americans as a whole are twice as likely to have liver cancer than white Americans, Laotian Americans specifically are more than 7 times more likely. So now that we've discussed some examples of data aggregation, I'd like to talk about these factors we should focus on going forward to address these health disparities. First, data inclusivity. Distribute culturally adapted health surveys in multiple languages to represent marginalized Asian subgroups, like the work of the All of Us research program. Second, promote awareness. Since only 2.5% of all medical papers include any data about Asian Americans. We could initiate including Asian American health disparities in education and partnering with Asian American organizations like the Coalition for Asian American Children and Families. Third, funding data equity. Lobby policymakers to get necessary funding for accurate data, just like the organization 15% and Growing has been advocating for. Much more funding is needed since only 0.17% of the National Institute of Health budget was spent on researching the AAPI community. In conclusion, policies based on aggregated data don't account for Asian American subgroups, such as these examples and more. To account for this issue, more awareness and funding is needed to enact change in public health policy. The takeaway for this is that data is not just a number. It represents the stories behind each and every one of us. And that is why advocating for an inclusive tomorrow starts with data equity today. Here are my references and my acknowledgements. Thank you so much for watching, and here's my contact info.